Anterior compartment of the leg. In the anterior compartment, there are four muscles: tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneal tertius. The origin of these muscles are, in case of tibialis anterior, it arises from upper two-thirds of lateral surface of the shaft of the tibia, lateral condyle of tibia, and adjoining interosseous membrane. Tibialis anterior is inserted into infromedial surface of medial cuneiform adjoining base of the first metatarsal bone, along with peroneus longus muscle. Extensor hallucis longus arises from the middle two-fourths of medial surface of shaft of fibula adjoining interosseous membrane, and it is inserted into the dorsal surface of base of distal phalanx of big toe. During its insertion, the hallux means the great toe, so it inserted into the phalanx, distal phalanx of the big toe or great toe. Extensor digitorum longus arises from the lateral condyle of tibia, upper 1/4, anterior half of middle 3/4 of shaft of the fibula with interosseous membrane. These extensor digitorum longus at first split into 4 digits. Then these digital portion inserted into base of middle and distal phalanx of lateral foretoes. In peroneal tertius, it arises from the lower 1/4 of middle surface of shaft of the fibula with adjoining interosseous membrane. Then it inserted into the dorsal surface of the base of the fifth metatarsal bone. Now, artery supply of the leg of the anterior compartment. It is supplied by anterior tibial artery, which is the branch of popliteal artery. This popliteal artery is a continuation of femoral artery. At the popliteal fossa, this artery divides into two and forms anterotibial artery and tibio-peroneal trunk. This anterotibial artery goes forwards through an opening into the interosseous membrane. Then it supplies the muscles of anterior compartment of the leg. These muscles are supplied by deep peroneal nerve, which is the branch of common peroneal nerve. This common peroneal nerve divides into deep peroneal nerve and tibial nerve. If this nerve is injured at the level of neck of the fibula, then the muscles of anterior compartment loss its stimulation. That causes loss of dorsiflexion of the foot, because all the muscles of the anterior compartment causes the dorsiflexion of the foot. When this loss, then the back of the muscles of the leg become upper hand, which causes the plantar flexion of the foot. This condition is called foot drop. Now, the action of these muscles are, especially all the muscles combinedly causes the dorsiflexion of the foot at the ankle joint, this is the normal position of the foot, and this is the dorsiflexion. During dorsiflexion, the dorsum of the foot goes towards the body. This angle decreases during the flexion, dorsiflexion position. Individually, the extensor digitorum longus, which forms 4 digits and inserted into the distal 4 phalanx, this causes extension. So, now the name is extensor digitorum longus. It causes the extension of these lateral 4 toes or phalanx. Extensor hallucis longus. Hallus means great toe. This muscle goes to the hallus or great toe. So it causes extension of the great toe. Tibialis anterior, individually it causes inversion of the foot, that is the lateral margin lies lower and medial margin of the foot elevated and faces sole of the foot faces medially. This portion is called inversion, and this is caused by tibialis anterior. Peroneus tertius is an everter of the foot, which is the opposite action of inversion of the foot. There is a retinaculum in the front of the leg. Retinaculum means condensation of the deep fascia. This is a modification of deep fascia. There are 2 retinaculum. One is superior retinaculum and another is inferior retinaculum. The superior retinaculum attached medially to the lower part of the anterior border of the tibia and laterally to the anterior border of the lower part of the fibula, and forming an elongated band just above the lateral malleolus. The inferior extensor retinaculum is a Y-shaped band. The stem of the Y lies laterally and the upper end goes upward and lower end goes downwards. The stem lies laterally and attached with the lateral margin of the sole in front of the ankle joint. And the upper band, which passes upward and medially, it attached to the anterior border of the medial malleolus. And the lower band, which passes downwards and medially, and it is attached to the plantar aponeurosis of the sole. The function of these 2 tendons are hold the structures of the anterior compartment of the foot. That means the tendons of the muscles of anterior compartment, the blood vessel and nerves of the anterior compartment to keep the proper position. Medial compartment of the leg. It is formed by medially of the shaft of the tibia, and it is covered by skin and superficial fascia. Upper 1/3 provides insertion of gyros. Gyros means the sartorius, gracilis and semitendinosus muscle. These 3 muscles collectively called gyros because they have a same insertion but origin is in different portion of the hip bone. That means from 3 part of the hip bone it arises and holds the hip bone in proper position in a tent-like manner. These 3 muscles are separated by anserine bursa. Tibial collateral ligament, which is the ligament of knee joint, it represents the degenerated part of the adductor magnus muscle, which attached behind the muscles. Skin, superficial fascia and periosteum of this region are supplied by saphenous nerve. The great saphenous vein ascends in front of the medial malleolus and drains into the femoral vein.